how we can have dialogues, begin to have national dialogues with the convening of the AU or the Africa CDC to understand how those vaccines can truly be distributed in a timely manner. With the news with Moderna, to be quite honest, I haven't seen that news already. I think as I move into this press conference, some of your colleagues were texting me to comment on that, but I haven't seen that. Once I look at that, I believe it's a press release. I haven't seen it. Then I will be a better place to comment. But all what we do as Africa CDC is to urge the manufacturers to work with us very closely. Remember, we have the Partnership for African Vaccine Manufacturing, PAM, which was set up and launched by the head of states, and we continue to work in that framework so that it is better coordinated in a way that we look at the entire ecosystem of vaccine manufacturing in Africa. And you are absolutely right that vaccine manufacturing is very, very much welcome news. It is a news or efforts that will address our medium-term to long-term needs. It doesn't necessarily solve our problems today. The problems we have to solve today is access, a quick access to vaccines, redistribution of vaccines, making sure that certain licenses are provided so that manufacturing can start regionally, like the Aspen group in South Africa, enabling them to produce more so that the Johnson & Johnson doses can be made more available. But again, without reading the communique from Moderna, we welcome any news to join us in the Partnership for African Vaccine Manufacturing.
Thank you. Just one quick follow-up. Could I have one follow-up?
Just one, please, Maggie.
Thank you. Okay, I just wanted to confirm that Moderna, it seems to me that Moderna has not communicated directly with Africa CDC about this plan for the factory. Is that correct?
Not that I'm aware of personally as the director of Africa CDC, but it's also not excluded that they have talked to my other staff that they have not vetted that information to me, but I have not personally seen any communications from Moderna.
All right, thank you. We move on, and this time it's hello to Chinedu Asadu, who is with the Associated Press. And Chinedu says, I remember that the African Union was offered 300 million doses of the Sputnik vaccine by Russia. How many doses have arrived so far, and how many people have been vaccinated with those doses? And also, are there any concerns about the Sputnik vaccine and whether health officials can actually rely on receiving shipments of that vaccine on time? So that was the first batch of questions, sub-questions under one question. Then secondly, he says, what specific changes does the Africa CDC director hope that the newly recommended malaria vaccine would bring to the continent, considering its malaria burden?
So with regards to the Sputnik vaccine, as we indicated last year, that they were willing to put it on the platform. Okay, let me just make sure that I distinguish between what Harvard has secured and then what companies are ready to put on the Harvard platform. When we refer to the Johnson & Johnson 400 million doses of vaccines, there are vaccines that contracts have been signed. I've learned a lot in this process where you engage a company, then contracts are signed onto, and unless you sign that contract, you have no vaccines. So I think that is so you can count the 400 million doses of vaccines from Johnson & Johnson as vaccines in the pocket, which means you can rely on they will be distributed progressively to next year. Now, when we engage with the Sputnik, we said, look, you have tell us how many vaccines you can put on the platform on your own, which means that there's no prepayment, okay, of the vaccines. When we sign these contracts with Johnson & Johnson, there's pre-financing from the Afro-Exim Bank. So that is not the case with the Sputnik vaccine. We said, look, your vaccine, we've seen the data and the efficacy data and the safety data. It looks good. Feel free to put that on the platform. They said we'll put 300 million doses there. Countries, as you know, are buying directly from the Sputnik producers. We have no control over that. We don't determine what countries do or do not do. What we do is we give overall guidance to countries. you also know that the Sputnik vaccine has not yet received the WHO emergency use authorization. So we continue to remain hopeful that they will give us, they will get that authorization, so that it puts everybody on a firm ground that WHO as the authoritative body in this space has given their stamp of approval there. So I'll leave it at that. So that is what we know so far with that vaccine. With regards to the malaria situation, is, as you can imagine, is going to dramatically change the way we fight the malaria endemic disease. If vaccines, they become accessible, because I still don't know yet the cost of the vaccines and how quickly they can be scaled up, okay, so that you can factor that into your vaccine immunization programs. Remember, this is what WHO announced was the outcome of clinical trials that were done in 3 countries, Malawi, Kenya, and Ghana. We now need to see that massive production have occurred. And once that happens, then we will be convening meetings with member states, and of course, together with WHO, to look at the vaccination program for that vaccine. So for now, it's still too early to state if and how that vaccine will be used. To state how the vaccine will be used, not if. If it's available, we'll use it. But how do you use it is still lend itself for discussion.
Thank you very much, John. We go over to Nairobi, Kenya, and say good morning to Leon Lidigu, who is with the Daily Nation. Leon, you want to ask your question live. Please go ahead.
Thank you so much. Good morning, Dr. Nkengasong. I have 3 questions. Number 1, there's a lot of fear and speculation concerning expectant mothers, and I've spoken to some of them, and they tell me that they are not taking the vaccine because, number 1, their husbands are barring them from taking the vaccines for fear it might harm the baby. And number 2, they're just generally afraid. So I would want to know, which strategies are we using to ensure that the uptake in this group of pregnant mothers is much higher? And number 2, where are we with the intellectual property for manufacturing the vaccines for as we are thinking about manufacturing, because as Mr. Strive Masiyiwa indicated previously, we are having a lot of challenges there. Are we having more conversations, or what new decisions have been made? And also with the challenges that Aspen in South Africa has been facing as it struggles to ramp up their fill and finish approach, how many doses are we likely to see from them in the coming few days or weeks? And then finally, are there any plans to acquire the new Covaxin vaccine that is almost being approved by the WHO, as Bharat Biotech has indicated, and India? And then India said it will soon resume to vaccine exports. So how many doses are we likely to get from that end? Thank you.
So thank you. So many questions that let me try to take them as best as I can. The issue of come again the issue of vaccine skepticism from parents or concerned people in the community. We just have to admit that vaccine behavior towards vaccine is an issue that has been there before. So I really want to be sure that everybody understands that it didn't start today. Vaccine hesitancy has been there. Those who have been involved in the polio vaccination programs will confirm that we always have had these issues there. It's not because there are these challenges that has ever stopped us from continuing public health work. So we just have to make sure that we use our community approaches and to increase the awareness of the vaccines and create guarantees. When you have a new product, it is expected that the community will be divided. As part of the community will be all outgoing and they want to get the vaccine, but part of the community will also be hesitant. But that hesitancy is not static. I mean, our own public health experience shows that it's always a tendency to move in the right direction once people are more engaged, you inform and educate the community with respect to the risks and benefits of the vaccine. So let's wait and see how this will happen. Anytime you introduce a change, they expect that there are other variables that you have to address in public health so that uptake can be facilitated. So with respect to the IP, I'm sure you're referring to IP more generally. And I think it's safe to say that their conversations are still going on across the board, not just for the malaria vaccine, but for other vaccines as a whole. How many more vaccines do we expect by the end of the year? As Harvard, we are expecting, again, the vaccine field is very slippery, but I always like to put out the numbers there, and if we don't get to those numbers, I will tell you that we didn't. Harvard is expecting that by December, we'll put out there almost about 35 million doses of vaccines. That is a single dose of Johnson & Johnson, meaning that it will be the equivalent of about 70 million doses of a double vaccine. So let's remain hopeful that this scenario would improve. That is the distribution and the production, the fill and finish from the Aspen group in South Africa will improve, and we continue to hope so. New vaccines, yes, the biotech vaccine, we remain optimistic that it will soon hit the market. And I think there are other vaccines in the pipeline that will probably also be being introduced in the market as soon as possible. We are very encouraged with the news that India have said they will be releasing vaccines. Just how many vaccines, we don't know. In terms of quantities, we don't know. But we have been ordered by President Cyril Ramaphosa as the COVID champion to go to India with the COVID envoy, Strive Masiwa, and some foreign ministers and ministers of health to continue to discuss with the leadership of India on the need to release sufficient quantities of vaccines for Africa, given that we are extremely lagging behind our vaccination targets. I just explained today that we've only vaccinated about 4.5% percent of the population. And if we have to get to at least 70%, the new target, then we have a long way. So that is really justify that why President Ramaphosa would, as the COVID champion for Africa, would consider it necessary to dispatch a delegation to go to India.
Thank you, John. Good morning to Sophie Mokwena from the South African Broadcasting Corporation. Sophie, please go ahead with your question.
Thank you. Dr. Nkengasong, you spoke about your meeting with the Minister of Africa, UK Minister of Africa today. There are reports that countries such as South Africa are likely to be removed from the red list today. Are you also expecting the same announcement? And then the other question, it is around the pharmaceutical companies around the world. The WHO did convene a special meeting with all stakeholders that will include your World Bank, IMF, the pharmaceutical companies around the world, and other institutions that are able to finance programs such as a fight against COVID-19. And the meeting was convened specifically to plead with pharmaceutical companies to release stock to Africa, what you are talking about, to have access. And they spoke about countries that are supposed to play their part in allowing the export. How far is that process of ensuring that major countries, particularly your developed countries, where you have these pharmaceutical companies, are able to allow the pharmaceutical companies to sell to poorer countries, the developing countries? And then the last one is the issue of countries using all vaccines. It was a request from WHO that countries must buy vaccines that have been approved by WHO, and it looks like people are still relying heavily on Johnson & Johnson and Pfizer. What are you doing about this issue? And perhaps an update in terms of vaccine uptake.
So, Sophie, let me start with the last question. As you know, we have a menu of vaccines out there. The question is access to those vaccines. Even if you have the money, I mean, can you access those vaccines, given that the manufacturing is capacity, global manufacturing is limited? We are not imposing Johnson & Johnson on any one country or any user. I've explained severally on this platform how and why we ended up with Johnson & Johnson. And that is also true for Pfizer. We have a menu of vaccines, the Sinopharm, the Sinovac, the AstraZeneca vaccines, and I believe Moderna. So if a country wants to buy those vaccines, they are absolutely free to do so. And they have all been qualified by or issued the emergency use authorization by the WHO. So we, I don't know if that was the question. So in terms of the access, the meeting that you described with WHO, World Bank, Pharmaceutical, I'm sure that list will probably, I wasn't part of that meeting, so I'm not privileged to the conversations and the deliberations there, but I'm sure the WTO, the World Trade Organization, would have been part of that meeting. And I think it is Dr. Ngozi's really championship and advocacy that is driving some of these things to happen, which is access to trade barriers and access to pharmaceutical and diagnostics there. So I'm not privileged to that conversation. So I cannot discuss it knowledgeably, unfortunately so.
Let's take in our live